Hello everyone and welcome to my channel. I am Dr. Renee McDermott, a mom and a physician, and I am radical for the mission to find better treatment options and curative options for all sickle cell patients. You might be wondering why I'm doing this. My primary reason for creating this channel is to spread awareness about sickle cell anemia and to be an advocate for those who are still waiting for better treatment and curative options. Today I will be talking about my son Landon, who was diagnosed with sickle cell 3 years ago, and I will also be sharing our journey and how my husband and I made the decision to pursue a bone marrow transplant for Landon to cure his sickle cell disease. Landon was only 17 months old when he had his bone marrow transplant, which was August 6, 2020, in the middle of the pandemic. And it's important to me to have answers for my children one day when they are old enough to understand. I want them to see that I didn't just move on with my life after Landon was cured. I want both Landon and Avery to see that life is not only about your victories. It's also about using the gifts that God gave you to help others in whatever way you can, and making the decision to live on purpose. So as we approach the second anniversary of Landon's bone marrow transplant, I am feeling incredibly grateful and blessed, and my mission is to advocate for every single person with this disease, because I know that they are waiting for their chance to have a life-altering treatment and a cure that will be accessible to everyone. Before I get into how my husband and I made the decision to pursue bone marrow transplant for Landon, I want to walk you through some historical milestones for sickle cell disease and the alarming statistics. So sickle cell disease was first discovered in the 1900s, and it is the most common inherited blood disorder, affecting about 100,000 Americans, mostly of African descent, and 20 million people worldwide. Sickle cell disease is a single gene defect in which the shape of the red blood cells become deformed, and instead of having round and flexible red blood cells, people with sickle cell have inflexible, deformed red blood cells that lead to a lot of destruction in the body. In 1984, a child who had both leukemia and sickle cell disease had a bone marrow transplant, and they were the first person with sickle cell disease to be cured from a bone marrow transplant. That was over 30 years ago. So why are so many people still suffering with this chronic life-threatening medical condition? The truth is, for many years, there was little interest and little to no funding for sickle cell disease and research to obviously focus on treatment and curative options. This is largely due to the existing racial disparity and the fact that people who are affected by sickle cell disease are mostly of African American descent. In the 1970s, one of the great achievements of this civil rights movement was to create the Sickle Cell Disease Association of America, which led to the Sickle Cell Anemia Act of 1972. Since then, there has been more public awareness of this genetic disorder, with some improvement in funding towards better treatment and curative options, but it is still not enough. So what do I mean when I say it's still not enough? Where are we today? Let's look at the statistics. There are 100,000 people in the U.S. with sickle cell disease and 20 million worldwide. Bone marrow transplant might be an option for at least a third of 20 million people with sickle cell disease. And that is a pretty significant number, right? right? That's potentially millions of people that we can make a difference for. So you might be asking yourself, well, how many bone marrow transplants have been done to cure sickle cell disease? Well, obviously, bone marrow transplant comes with risks, and over many years, through research and experience, the entire bone marrow transplant process has improved, and awareness as well. And so the number of people that have undergone bone marrow transplant is fluid. But from the information sources I have seen, there's only about 2,000 people with sickle cell that have actually undergone bone marrow transplant so far. So imagine how many lives could be changed if we had enough worldwide support and more funding for better treatments and curative options. And do you know what else is shocking about this? I personally think that it is shocking that with all of the medical advancement we have made for so many medical conditions, that we have yet to come up with better medications to slow the organ damage that we see in sickle cell patients, and also more accessible curative options. Bone marrow transplant is an option that, like I said, comes with risks, and I will go into details about that as well. But in the case of benefits for sickle cell patients, particularly younger patients, the benefits far outweigh the risks. Only 20 to 30% of children who need a transplant have a matching sibling who can donate, but we are not getting the majority of that 20 to 30% to transplant. Medical evidence shows that younger patients, less than 16 years of age, and patients that are transplanted more recently, and this is after 2006, that they have better outcomes with less complications. The more recent studies show that the cure rate for children with sickle cell disease undergoing a bone marrow transplant with a matched sibling donor is about 95%. That is 95%. Okay, another way to look at this is, on average, when 10 children with sickle cell disease underwent a matched sibling bone marrow transplant, 9 out of 10 children were cured. Okay, that is remarkable, and that is remarkable progress for patients with sickle cell disease. We have a long way to go, but this is just to kind of give you an idea of where we are today. So another important point I think to make is how or what is happening in the medical community to advance treatment and curative options for sickle cell disease. Another milestone, I think, was reached in 2018, where we saw that the National Heart, Lung, and Blood Institute, they launched the Cure Sickle Cell Initiative to accelerate the development of gene therapy to provide more accessible curative options for people with sickle cell disease. There is a lot of optimism around gene therapy, and so far the results in preclinical and clinical trials are promising, very promising. I will be talking more about this as well as other treatments in future videos. But before I get into more details, please keep in mind that all information provided on my channel in any format is for information purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. The information I share is not meant to diagnose or treat any medical condition. Always consult your physician or a qualified health professional with any questions regarding a medical condition. and never replace medical advice that is given by your doctor or a qualified health professional, or delay seeking medical advice or treatment because of something you read, watched in a video, or saw in any format on my channel. Also, the pictures and illustrations and the diagrams that you will be seeing in this video and a follow-up video, they do not belong to me, and I do not have rights to them. I have included the resource links for all the pictures, illustrations, and the diagrams that I've used in the video as well. Okay, so let's get back into it. I also want to talk about a few other things before I get into the bone marrow transplant process. The important things to talk about to get a full understanding of the transplant process is giving a little more detail about sickle cell and how it is inherited, explaining what a full match donor is, and what bone marrow means. The bone marrow transplant process is very complicated and it can be overwhelming. So I think explaining a few things first will make it easier for you to understand the bone marrow transplant process. So bear with me. So what is sickle cell disease? I explained earlier in the video, in the earlier part of the video, that in sickle cell disease, normal red blood cells are replaced with sickle cells. So people with sickle cell disease do not make hemoglobin normally. And so what is hemoglobin? Hemoglobin is a substance in red blood cells which carries oxygen throughout the body. And we all need oxygen to live, right? My son has the most severe form of sickle cell disease, which is hemoglobin SS disease, or HBSS disease. So my husband and I are both carriers of the sickle cell trait, which means that each of us have one normal hemoglobin gene and one sickle cell gene. There is a picture that's inserted on the screen to make it a bit easier for you to follow. My daughter Avery, who will be 6 years old this year, actually this month, inherited the normal gene from me and the normal gene from my husband, whereas Landon inherited the abnormal sickle cell gene from me and the abnormal sickle cell gene from my husband. So Landon ended up with 2 sickle cell genes. Another point I wanted to discuss is that some people use the term sickle cell anemia to describe sickle cell disease. And this is because anemia is a condition that is commonly associated with sickle cell disease when there isn't enough circulating red blood cells. And this essentially can lead to decreased oxygen flow to the organs in our body. Anemia can develop in patients with sickle cells because their red blood cells have a much shorter lifespan than, say, healthy normal red blood cells. The lifespan of normal red blood cells is 120 days, which means that they can live for 120 days before they need to be replaced. Whereas with sickle cells, their lifespan is extremely short and is only 10 to 20 days. And in the case where the lifespan, because the lifespan of the sickle cells is so short, people with sickle cell disease end up with a shortage of red blood cells, resulting in anemia. So sickle cell patients with this condition usually require blood transfusion, and some people with more severe disease become dependent on blood transfusions. And so now that I've gone into a little more detail about sickle cell disease, I want to switch gears and talk a little bit about bone marrow transplant, so that when I share my son's story, everything will make more sense. I mentioned earlier, my husband and I decided to pursue a bone marrow transplant for Landon because the more recent studies that we reviewed showed that the cure rate for children with sickle cell disease with a matched sibling donor is about 95%. The benefits, as far as we saw it, far outweighed the short-term risks. And so we felt pretty comfortable about moving forward with the bone marrow transplant because for us, sickle cell disease is so unpredictable. The course of sickle cell disease is, cannot be predicted by anyone. And we could not predict if our child would survive through childhood or survive through even part of his adulthood. And so for us, making that decision to take this risk with the short-term risks of complications from the bone marrow transplant, and which includes even dying from it, that we were willing to take that risk for our son. I will discuss risk and benefits of the bone marrow transplant later on as well. But before I do that, I wanted to first explain what a matched sibling donor is. So what is a matched sibling donor? What exactly does that mean? A matched sibling donor describes either a brother or a sister who shares the same mother and father that have an identical immune system blood type. There's a blood type for the immune system called human leukocyte antigen, or HLA. And these antigens are proteins on most cells in our body, and our immune system uses these proteins to see which cells belong in our body and which cells do not belong. When these cells see something as foreign or see something as not belonging, they signal the immune system to attack those cells and clear them from the body. So this is what happens if a donor and a recipient do not have matching proteins, which is not what we want, right? So when someone is being evaluated for a bone marrow transplant, like Landon, for example, they test Landon, who is the recipient, and they tested our daughter Avery, who is the donor, because she's donated to Landon. And so this is one of the first steps in the evaluation for a bone marrow transplant. They first have to check to see if both people are a match for the transplant to even happen. Landon was about 5 months old, and Avery was around 3 years old at the time when they had this test done. And the turnaround time for the test is about a few weeks before you get the results. So Avery turned out to be a perfect match for Landon. So there was less concern in that case that Landon's body would see her cells as the enemy, essentially, and attack it. So it can still happen, even in Landon and Avery's case, where for whatever reason, the recipient rejects the donor cells given to them. But it's much, much less likely if there's a full match sibling. The next thing I wanted to talk about is what a bone marrow is. And I also have some pictures here on the screen to give you a visual perspective. So bone marrow is a soft, spongy tissue in the center of our bones. This is where a lot of the action happens and where most of our body cells are made and stored. Stem cells are our body's what we call raw materials. They are found in our marrow, and again, that would be the soft center of the bone. All other cells, including our nerve cells and blood cells, come from stem cells. So that is why bone marrow transplant and stem cell transplant are used interchangeably. The stem cells are what is needed in a bone marrow transplant to cure certain types of cancers and other diseases, such as sickle cell disease. If the bone marrow doesn't function properly because of cancer or another disease, a bone marrow transplant may be an option for some people. And in the case of sickle cell disease, bone marrow transplant has been proven to be very successful in patients, particularly when they are younger than the 16 years of age. Before we get into Landon's bone marrow transplant, I'm also going to talk a little bit about the preparation process leading up to the bone marrow transplant. The preparation process for Landon's bone marrow transplant was between 1 to 3 months prior to the date of his transplant. Within that period of time, the doctors ordered different tests to check how his different organs were working and to make sure that his body was able to handle the bone marrow transplant. The next phase for Landon was the first round of chemotherapy, which happened 3 weeks before his transplant. So he was admitted to the hospital mid-July of 2020 for his first round of chemotherapy. And this first hospitalization actually was, pretty challenging because he did have a reaction to the chemotherapy, and pretty severe reaction. And with the help of the doctors and everyone on his team, they were able to get him through enough of the chemotherapy in order to ensure that the bone marrow transplant would be successful. So when I mentioned chemotherapy, what is that and why does he need to have it? Well, chemotherapy is necessary because it basically cleans out the bone marrow and puts the immune system in check, puts it on mute, right? And this is necessary because, for example, Landon is going to be receiving or did receive Avery cells, right? And so the point of chemotherapy is to clean out the bone marrow and as much as you can, so that it's not crowded with his cells, and that the immune system is suppressed enough to not cause him to reject Avery cells. Landon received chemotherapy, like I said, three weeks before his transplant, and he received 3 different chemotherapy agents. Of course, chemotherapy is very toxic to the body, but it's a necessary evil because that is how the best tools that we have so far to suppress the immune system and prepare someone's body, which we call conditioning, prepare someone's body to receive donor cells. Another thing that I should explain, or I should mention, is that Landon also went to the operating room to have a placement of a big IV line in a large vein near his heart. And that line is usually placed, when it's placed, you will usually see the line extending out of the chest wall. This big IV line is necessary for giving multiple medications, including chemotherapy, effectively. This big IV line, or what we call a central line, is also necessary because, if Landon got really, really sick and needed a lot of medications or life-saving measures, this line provides access to deliver medications quickly and effectively. my husband and I also made the decision to have a small piece of Landon's testicular tissue removed and stored for fertility preservation for when he becomes an adult. And, I will go into more details about that and the options for that and why we decided to do that as well. This position was done at the same time during the central line placement, so it was simplified things because we were able to have both procedures done in one shot. So after Landon's first round of chemotherapy, he was discharged from the hospital and returned 12 days later for his second admission. During his admission, he received more chemotherapy, and about 8 days later, he had the bone marrow transplant. And he essentially remained in the hospital for about 6 weeks. So you might be wondering what the bone marrow transplant day was like, and the one word answer for it is that it was crazy. It was a super emotional time, very stressful, and so as I'm going through this and I'm explaining the process and how this works, I think it's really important to also express that this process takes a lot of support from family, friends, loved ones to get through those really rough days. We had a super stressful day. It was, our day started pretty early at 5 in the morning, and because we had to get Avery to the hospital to get her to the OR on time for them to do the bone marrow harvest. And so that was a process in itself. And just having the two kids in the hospital, navigating the system, and having it be in the middle of the pandemic, it was just an insane time. In Landon's case, for the transplant, they used Avery's umbilical cord that we had collected at the time of her birth, and they did a bone marrow harvest to get more cells from Avery's bone marrow because the umbilical cord cells was not enough to do the full transplant. So guys, Avery was 10 days away from her 4th birthday when she donated her bone marrow cells to Landon. She was given medications to put her to sleep and then taken to the operating room where they collected her stem cells from her hip bone. I also have a picture on the screen to kind of, as a visualization of what that procedure was like. So they collected the stem cells with a needle that is placed into the marrow. And this process is called bone marrow harvest or bone marrow procurement. The stem cells were sent off to the lab to go through a filtering process. And once the filtering process was complete, the cells were then ready to be given to Landon. So my husband stayed with Landon on the bone marrow transplant unit because Landon is only 17 months. And so a parent has to be present with him at all times. So guys, Avery was 10 days away from her 4th birthday when she donated her bone marrow cells to Landon. She, on that day, we got there pretty early in the morning. I believe our arrival time was for 7 a.m. And before they wheeled her off to the OR, they gave her medications, put in an IV line, did the typical process that they do before taking anyone into the OR. And so she was asleep for the procedure. I do have a picture here on the screen to kind of give you the visual of what that procedure is like. So they collected the stem cells with a needle that is placed into the marrow. And this process is called bone marrow harvest or bone marrow procurement. They are used interchangeably. The stem cells were sent to the lab to go through a filtering process. And once that filtering process was complete, the cells were then ready to be given to Landon. And so Avery's procedure happened in the early morning, and Landon had the bone marrow transplant done with the infusion of the cells around mid-afternoon on the same day. During that time, my husband stayed with Landon on the bone marrow transplant unit because, in Landon's case, he was only 17 months old. And so a parent had to be with Landon because, of his age. He was too young to be by himself. And so I stayed downstairs in a different part of the hospital in the waiting area until Avery returned from the OR. And so, when Avery woke up, of course, I wanted to make sure that she was okay, that she didn't have any, pain or any complaints. And it was pretty remarkable. She was herself. She didn't have any pain. She felt fine. She was eating okay. And, and so she was discharged pretty shortly after she came out of the OR. And I have videos of that moment when we went home, and she was talking about Landon and what she did for Landon. And so I have the video of that moment, which is just a really special moment to see. And that day was just a really special moment for me as a mom, having this gift of my daughter being able to donate her cells to her brother. So like I mentioned, Landon received Avery's umbilical cord cells and the fresh stem cells that were harvested from Avery, and that was given to Landon the same day. So I do have some footage of the bone marrow transplant actually in the room when Landon was receiving the Avery cells, and part of that process also was having the cells blessed by a chaplain, and who is a part of the bone marrow transplant team. So we were really happy about that, and also some pictures of just the process and some of the not too good moments during that process as well. So there it is, everyone. That was our process leading up to Landon's bone marrow transplant. And there is much more to share in our experience and during that time, the post-transplant process, and also, where we are now, that Landon is now 3 years old. But that's all I have for today, and I will be sharing more information, like I said, about the transplant period and some of the challenges we faced as well. I will also be posting a video of footage and pictures we have from Landon's transplant from August 6th. So also, I would like to remind you to please check below for resource links if you would like more information about sickle cell disease, or you are interested in signing up with the BMatch registry. I hope that you liked this video, and if you like this video, please like and subscribe, and I will see you next time.